everybody, and welcome to the 2026 Global BioInnovation Forum. My name is Erica Olenski, and I'm a Vice President at FINN Partners. The Global BioInnovation Forum brings together leaders who are redefining how health systems discover, deliver, and finance care. You're joining a global community of innovators from research institutions, health systems, life sciences companies, technology platforms, and investment firms, all working to translate scientific breakthrough into real-world health impact. The BioInnovation Forum is fundamentally changing how we predict, prevent, and treat disease, and it's redefining what is possible for human health, particularly for the communities and populations that rely most on strong public health infrastructure. It's now my great pleasure to introduce Verlon Johnson, Executive Vice President and Chief Government and Corporate Affairs Officer at Acentra Health. Verlon is a nationally recognized healthcare strategist with nearly 30 years of experience shaping Medicare, Medicaid, and CHIP policy and operations. Her career has been defined by translating complex policy into actionable strategy, modernizing large-scale systems, and leveraging technology to improve access, quality, and outcomes for priority populations. In today's conversation, we'll explore how policy innovation and technology intersect to build resilient, equitable health systems and what it takes to turn bold ideas into measurable impact. Verlon, welcome, and thank you so much for joining us.
Thank you, Erica. I'm really excited to be here today to talk about Medicaid during this forum for sure. As you said, I'm Verlon Johnson. I work for Acentra Health, and we're a company that really partners with states to design, build, and operate the systems and services that really make Medicaid work. But if I have a moment here, before we talk about Medicaid, I kind of want to ground us into why this work matters to me personally. I've spent my career at the intersection of public policy, government operations, and healthcare delivery, really working alongside governments, in government, alongside states, and now with Acentra Health. And I've always focused on one core question for me, and that is, how do we make large public systems actually work for the people who rely on them? And so for me, Erica, Medicaid isn't abstract. It's really deeply personal. We've had many conversations before, but definitely earlier in my career at CMS, the Centers for Medicare and Medicaid Services, when I worked specifically on Medicare, I was actually leading work on the Medicare prescription drug program. I know I'm dating myself, but I worked on that great program. And so at that time, I learned more about the low-income subsidy, which required close collaboration with state Medicaid agencies. And in those conversations with state leaders and teams, I saw just how personal Medicaid really is. And I didn't just learn the program, Erica, I fell in love with it. I saw what Medicaid does when it works well. It's not just about policy, it's really about possibility. So again, I am so excited to be here to talk with you all today about Medicaid for sure.
Wonderful. Well, thank you, Verlon. I'm thrilled to have a conversation with you anytime, of course. To get started, could you, share with some of the listeners and viewers, what's the current state of Medicaid in maybe one sentence or in a brief sentence?
Yeah, okay, a brief sentence.
If possible.
Sure. Medicaid's complex, but that's okay. I think I could probably break it down. So if I had to describe, I guess, the state of Medicaid in one word, it would be infrastructure, right? Medicaid isn't charity. It's infrastructure. It's that digital, operational, and policy background that really allows states, health plans, and clinicians to really deliver care for nearly 80 million people. So when Medicaid works, the entire healthcare system works better. And I would also say that what is often missed is just how foundational Medicaid really is. It's really embedded in state budgets, it's in hospital financing, it's in behavioral health delivery, it's in maternal and child health. So that's virtually every part of the healthcare system because it's jointly funded and administered by the feds and the state, it really operates across multiple layers of accountability. So the demands on Medicaid have increased. There's more oversight, there's higher expectations around equity and access, and greater delivery complexity. And so while much of this is really about, providing that care, that underlying infrastructure really has not kept pace, right? And so today, Medicaid remains strong in mission and proven in impact, but really under some operational strain. So whether we invest in the foundation whether we invest in the foundation will really help the resilience of the broader healthcare system at large. So that's how I'd say, in one word or less, in a couple of sentences, really where Medicaid is right now.
I love it. Well, so expand for me a little bit. What is changing fastest for states today?
Oh, wow. I mean, everything is going fast these days for sure. So I would say what is changing fastest is that widening gap between what Medicaid programs are being asked to do and the systems many states are still using to do it. As I said earlier, states are managing those tighter budgets. There's an increased federal oversight, and there's also higher expectations around access, equity, and performance, while also facing some workforce constraints and aging technology, right? So I think what state leaders consistently express is not resilience to change, but really concern about the pace of it. They're being asked to move faster, respond to policy shifts more quickly, and manage increasingly complex programs of tools that are not necessarily designed for today's scale. And at the same time, we have 50 states in case anyone's counting, right? Variation across states is widening, right? There's different fiscal realities, policy choices, and modernization maturity means solutions must be tailored rather than actually templated. So pressure is that common thread, I'd say, and that pressure is accelerated modernization as an operational necessity at this point for sure.
What would happen if a state delays its modernization efforts, let's say even for another 2 to 3 years?
Oh gosh, Erica. I mean, if states really delay modernization, I think they do not simply pause progress, they actually compound the risk. When we think about it, delays can increase administrative costs for sure. They're already strained already by stretched staff, and of course, it limits the state's ability to respond to policy changes, economic downturns, and even public health events. Can I just say COVID, right? They also increase a reliance on manual workarounds. I think that are introduced consistency and error as well. So, that's all to say that there is also significant opportunity costs, right? States that delay miss chances to simplify eligibility. They will miss improved data sharing possibilities, and they might not be able to create more seamless experiences for their members and the providers. So, when I look at the policy groundwork, I'd say it's already been laid, right? We've seen federal funding mechanisms, interoperability standards, and program guidance really exist. And so the challenge now is really operationalizing those things for sure. So, modernization does not have to be massive or disruptive. Let's be clear about that, right? It can actually occur in phases. But momentum is what I really want to talk about here because momentum really matters. Waiting makes modernization more expensive and actually more difficult later. So, let's try to do it now to the best of our ability for sure.
Really fascinated by this concept of modernization, especially in the world today. What do you mean by that specifically?
Yeah, you're right. I think all words can have different meanings, right? And so let me step back. I think when I think about modernization, it's not about ripping and replacing entire systems or even chasing some new technology for its own sake, for sure. It really is more about, strengthening our core, right? Eligibility and enrollment, data sharing, interoperability, so that people experience fewer barriers and state staff can work more efficiently and consistently as well. At its core, when I think about modernization, it's really about adaptability, Erica. Can systems respond to policy changes? Can data move where it needs to move to? And can staff focus more on judgment and less on that manual processing, right? So successful modernization happens in phases, as I said earlier. It's about modular. It's about flexibility. It's about being grounded in real operations rather than this theoretical kind of architecture kind of thought process. So I think that when done right and well, years of investment really can translate into clear pathways to care, very important, of course, more timely services, and systems that really feel more connected and humane overall, for sure.
When I think about modernization and you expand on that,
Yeah.
it leads me to think a little bit more about the federal role as well, and inspiring perhaps leadership there. What is what does the federal level of influence mean for modernization?
Yeah, so of course, I spent many years within the federal government, and so as I think about that from that perspective, but also in the role that I play now, CMS really plays a very important role in overseeing federal investment in state Medicaid systems, and so that's a really strong partnership. So I would say, thanks to CMS guidance and sponsorship of technology investments, states have really been able to really play more of a meaningful role in progress towards modernization. I'm going back a little bit more. So, like I know during the Affordable Care Act, for example, there were these increased opportunities for system improvements that improved the Medicaid eligibility process through more modern state systems. And so the result from that was that you really saw more smoother Medicaid reviews, redeterminations, and renewals that really reduced state burden and strengthened coverage pathways for the Medicaid beneficiaries who belong in the program. So Medicaid, to say all of that, functions best, Erica, as a federal state partnership, and that is especially true for modernization. So that federal role is becoming more collaborative, I believe, and even more demanding for sure. When we think about waivers, increasing clearer data, stronger evaluation, and great accountability from a federal perspective, it really does help, though, the Medicaid program really show and demonstrate their value through the Medicaid dollars. And so when federal standards provide clarity, of course, and states retain flexibility, I think modernization moves faster and actually produces better outcomes overall.
Looking at it from another direction, where are these efforts failing the most often?
Oh, do we have to talk about failure, Erica? But yes, this is
Maybe
a
a little
real
bit.
time. It's a real thing. I know. So yeah, modernization efforts often fail, I think, when there is probably a disconnect between policy and technology. Medicaid is governed by statutes, by regulation, and sub-regulatory guidance, and so these rules actually must be operationalized correctly, right? So when technology leads and policy follows, systems do not align with how Medicaid actually works all the time, right? And so this misalignment quickly results in some change requests, higher costs and frustration for state and staff providers, which is not a good thing, as you know. And so for me, I think successful efforts really begin with policy and operations together. They ask what the rules require, how workflows really function in practice, not just on paper, but in practice, and what flexibility states truly need. So I think technology should really enable that and not override that. And I know that here at Acentra Health, we understand that the policy background is important. So our company and all of our solutions come from that fundamental base. And we also work with our clients to really understand how things truly impact them. And I think all of us should be thinking about that from that perspective.
What does a strong state vendor partnership look like when it's in practice?
Oh gosh. So I would say the most important thing vendors must understand is that success in Medicaid is not selling technology. I know, right? It really is, though, Eric, about earning that trust. And in the strongest Medicaid programs, relationships between states, the federal government, and the private sector are so grounded in trust and accountability that the word vendor naturally becomes partner. That is so important. It's really about partnership. And so that trust is going to take time. It is built through consistency for sure. Transparency is very important. And showing up when challenges arise, not only when things go really well, right? So partners understand Medicaid policy, they respect public stewardship, they design solutions that actually support how the program actually operates. And so in Medicaid, credibility is really earned over time, and it is easy to lose if the states are not respected from that perspective.
Yeah, that makes sense. You mentioned this concept of trust. One thing my mind goes to is therefore transparency.
Yeah.
What does transparency then look like during that implementation and even just ongoing operations?
Yeah, so again, transparency is really fundamental to me to about stewardship, right? So it really requires honesty about timelines, about the costs associated, the risk and the trade-offs, and accountability as I think conditions change, right? Because things could change from any given moment to moment, right? And so delays and cost overruns do not simply affect project plans, they actually affect coverage. I mean, we need to make sure people are getting their Medicaid benefits, right? Access and care. And so transparency protects both the program and I believe the people who rely on it. And so what does this mean in practice? I would say, that Centra systems our systems are very modular. We take a very modern approach to technology that allows for easier customization, more flexibility, simpler administration, and more efficient upgrades and maintenance. And so it's really a win-win because our approach helps the states be more nimble and that they can make changes themselves. That's huge, right? Rather than relying on a lengthy and costly change control process that just really slows down progress and adds cost. So transparency is key to all of that for sure.
Yeah. Transparency, trust, accountability, those words all lead me to think about AI, of course, which is what would a conversation in 2026 be today without talking about AI in some form or fashion? I'm sure AI is influencing Medicaid programs in some way as well. Where are you seeing AI useful right now for states?
Yeah, I mean, AI is definitely the topic of the jour, but it really is about moving it from the topic of the jour to actually seeing some impactful results for sure. And so I would say AI is really already delivering value for states when it's applied in the right way for sure. The use cases that I think we're seeing work today share a few common characteristics. They're very state driven, they're operationally focused, and they're really designed, most importantly, to support state staff, providers, and members, all in service of the people that Medicaid exists to really serve. And so we know this not just from experience, but also from what states themselves are telling us. And that's one of the reasons we actually launched the Safe AI and Medicaid Alliance, or SAMA, or SAMA, as some of my colleagues would call it. It really brings together Medicaid leaders, policy experts, and technology partners to really focus specifically on what safe and responsible AI adoption looks like in Medicaid. And so through SAMA, with the participation from state agencies like Washington, Arizona, we have great partners like AWS, McKinsey, Arcadia, and other health folks that are really focused on this and really addressing a real gap in the national AI conversation. It's unique operationally, it's about compliance, it's about equity, realities in Medicaid, and it's also about what states are seeing is in AI that can really help them manage at scale, complexity, and workload without losing that accountability. And
Yeah.
Erica, I just also have to say, this work really matters because state agencies are facing real workforce constraints, and even some small efficiency gaps can really help be very meaningful, I think, in the Medicaid space. So the benefit here really isn't about headcount reduction because it's never about replacing staff; it's about capacity. So I think that's really important when I think about AI for sure.
I think about it from the other direction. Where do you think it's being perhaps oversold, even in some ways today?
Oh, okay. I would argue with you, Erica, that I don't know that AI is actually being oversold as much as it's being misunderstood.
Okay.
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 Medicaid operates differently than commercial health care for sure. It's a public program with federal and state oversight, as we all know. There's strong expectations, legacy systems that really weren't built overnight. And that doesn't slow progress. It just defines how progress has to happen, right? So this is exactly why we created SAMA to really give states and partners that dedicated space to define what's safe, what's transparent and scalable in the real world. And so, as we were thinking about, as in the forums that we've been convening these conversations, actually at our first one, I think was at the Medicaid Enterprise Systems Conference, state leaders really focus on practical questions, the challenges they're facing, how states and private partners should collaborate, and how to really evaluate AI use cases through those shared frameworks and risk tools. We've actually grown to, I think, 32 states and one US territory that's actually having these conversations. And so I think the promise of AI and Medicaid is absolutely real. AI can reduce administrative burden for sure. It can really, again, help state staff make faster and more consistent decisions. It can really surface some insights from more complex data to help us improve that care. And it can really help free up time so people can really focus on that high value human centered work that's important. So, again, I don't necessarily think that it's being oversold, it's just misunderstood, and really want us to make sure we're thinking about it in a meaningful way to get us in the right place for it.
Fair enough. Fair enough. Top of mind, especially, looking at, the start of the new year and all of the current events coming out of
Uh-huh.
this space, chat gpt is maybe one layer lower than just ai as a whole. They're not synonymous, which we know. But I'm curious what your thoughts are, the impact of applications like chat gpt specifically on medicaid programs. Is there another layer deeper? Perhaps you could shed some insight.
Yeah, that's a great example. I really think these tools are really designed to help individuals connect their health data. They're to translate complex information, like I said earlier, into that plain language and really support more of that preparation navigation, not just in clinical decision making. And so I think that's important because, and at the same time, when I think about it, we're seeing health plans launch member facing digital assistants, and we're seeing vendors like ours really embed AI into the portals and apps to explain the benefits and next steps. And so to me, these signals are a broader shift, that AI is becoming this interface between people and the health system, right? And that matters a lot in Medicaid, where many members are managing multiple conditions, right, or programs. They're navigating these complex systems with limited time or support, or facing those barriers really related to literacy, language, or access. So AI can really help, I think, with that interface, for sure. So I think this moment is possible because we have federal interoperability, we have patient access policies that really have established the right to access health data and really create that technical pathways for that data to move. So this is where that policy, that technology, and that consumer experience finally intersect, right? That's
Oh,
exciting.
it's
And
so exciting.
I'm so excited. And it's an area I think that states are watching closely. And we all are, honestly. And just imagine what will be 5 years from now for sure. That would be
I'm even
something
just
that's
thinking a
exciting.
year from now, a
Yeah.
conversation next
I
year,
mean,
you
that's
and
for
I
real.
sit down
Exactly. You're right. You're
talking
right.
talking about, the year ahead. Gosh, yeah, the time scale, it seems, has really been radically
Yeah.
reimagined for all of us when it comes to these technologies evolving.
Yeah.
Verlon, tell me a little bit, if you can, or expand on Acentra Health. Who are you? Who are you guys as an organization? Where'd you come from? And specifically, maybe what is it that you guys are helping to solve for in this space?
Yeah, that's a good question, right? So, Accenture was really built to translate this policy, like I said earlier, into operations at scale while really keeping people, I think, at the center of that for sure, right? So, we take pride in really combining deep systems expertise with deep clinical expertise. We support states across the Medicaid lifecycle. We're currently working in, I think, more than 46 states, and it really gives us a vantage point into how different policy choices play out in practice. And our purpose is really simple, really is to help states make Medicaid work, not just today, but really into the future for sure.
Fascinating. What has not changed about Acentra Health's approach?
I think what has not changed is really our belief that technology alone is not enough, right? Medicaid is complex, it's highly regulated and deeply human. And so experience and trust really still matter, and they always will. And so as we think about how we provide services and technology solutions, and how we are that trusted partner, that's really what's important for us is to make sure we maintain that North Star for us.
I love it. I love it. Well, I love what you guys are doing. I mean, it's certainly very valuable work, and I really appreciate your perspective on all the emerging technology as well as the policy front as well. Any other final thoughts for listeners tuning into this conversation?
I don't want to leave a conversation without talking about how excited I am, even more so about Medicaid and the future of it. And I think what gives me optimism about the program is definitely the people. I think about the state leaders. I think about our public servants at the federal and the state level, our clinicians, our partners. They're all facing these, real constraints for sure, budgets, workforce challenges, of course, system complexity, but they're still choosing, Erica, to innovate. Medicaid has weathered major change before, right? I've been in this game, as you said, beginning for about 30 years, right? And each time I can say Medicaid has adapted because of shared commitment and leadership across the board. And so the future of Medicaid will not be built in theory, behind the walls of us great thinkers, right? It's going to actually be built by the people who care deeply about making the system work. And that gives me hope, optimism, and excitement about Medicaid today and always. But thank you so much for me having the opportunity to come and talk to you today about a
Oh,
program
of
that I
of
love.
course. Of course. Well, I share your enthusiasm. Thank you so much, Verlon. Your perspective is so valuable for all of us, especially as we work to solve problems in healthcare that are much bigger than any one of us individually. And so, thank you again for sharing your wisdom with all of our listeners and viewers. And gosh, I can't wait to see what our conversation might sound like a year from now, if we get an opportunity to do this again. That'd be great.
Okay.
Well, thank you, everybody. This is the 2026 Global BioInnovation Forum session featuring Verlon Johnson with Acentra Health. Again, my name is Erica Olenski with FINN Partners, and thank you again for joining us.